Welcome back. Today we are going to go through my first aid bag. As you saw in the title, I'm a paramedic and this bag stays in my truck 24/7. Stick around to the end. I've got a little bit of bonus stuff, something new that I'm pretty excited about. But let's get started on this. The bag itself is just a generic black backpack. I was looking and I don't really know anything about this. I got this bag when I was in the Army, just one they sold in the PX, basically the military supermarket, whatever. It's got some Velcro here, got my name and a patch on it. And then actually on the inside of this strap, I've got this Star of Life. And the reason I've got this on there is that if there's an emergency and I tell somebody to go grab the first aid bag from the back seat of my truck, they can see this and hopefully identify it fairly easily. That's the hope, at least. The outside, I've got a couple little straps on here just to make it easier to open stuff, but it is just a plain backpack. The first pocket here is right on top, and this is where I've got what's called PPE, personal protective equipment. So this is stuff like nitrile gloves. I've got some N95s and some surgical masks in here, and that's just easy to access, and that's the best way to protect yourself. There's a lot of illnesses and things that are in all kinds of bodily fluids, especially blood. So if you can put on some gloves before you start helping anybody, that'll help you out immensely. There's nothing in the next pocket, and then we'll move on to the main one. So, as you can see in here, everything is kind of in these pouches. And the idea behind that is it's easy to pull a pouch out and put it where it needs to go. I'm a paramedic, my wife's a nurse, a lot of our friends are in the medical industry, and a lot of the people we go out with have some sort of medical training. So it's pretty easy. If somebody goes down, I can just pull this out, toss it to somebody, and they can start using this. And so that's the way that it's set up. So we'll start up top here, and this is what's called a bag valve mask, and this is what you see in all the movies. They're squeezing it and they're breathing for someone. So I keep that up here, easily accessible. Luckily, I've never had to use that. Probably a good time to say, if you don't know what something is in here, you probably don't need to go buy it. I think it'd be very easy to just spend all your money on stuff that you don't need. I've got a lot of extra training in medicine, especially emergency type stuff, that if you don't know what you're doing with it, don't spend your money on gear, spend your money on training. So there's a lot of like wilderness first responder classes. There's a lot of other things like that, classes like a stop the bleed class, even just basic CPR and first aid. If you don't have that, it would be imperative to do that before you start going out in some of these super remote locations. So we'll start closest to me and work our way over. This is what's called a SAM splint. It's basically, think of it like chicken wire with foam on top of it. And you can bend this into all kinds of different shapes. And so say I broke my arm, you could build a splint out of this. And as you can see, it's very thin and packs up, doesn't take up much room, and it's pretty lightweight. So I've got that in here, and then you'll see another splinting thing in a second here. Then I've got two of these basically homemade stop the bleed kits. I figured I could put them in here, have everything I need, and I carry a tourniquet. This is a North American Rescue CAT tourniquet. There is a what's formerly known as Israeli bandage, a pressure dressing bandage in there. I've got a couple different rolled gauze. This one, yeah, these are just normal gauze that are just basically vacuum sealed in here. They are 4 yards long, packed up into this little bag. So those are good for packing wounds and things like that. I've also got some hemostatic gauze, and so these have some sort of like a medication on it basically that helps your body to clot quicker. And so you can use these if somebody's bleeding really bad. You can pack it in the wound and this will help hopefully stop the bleeding. And then I've also got some 4x4s in here. These are good for just kind of putting over top of wounds, using it as some sort of bandage material for that. And this one's exactly the same, and I have a couple more of these in other bags and things that I usually carry with me. So I'd like to get more. You've got 4 extremities. Ideally, I'd have 4 of them, but there's only room for 2 in this bag. So like I said, I do carry extra ones, but and also you can see that they're well labeled. So if I tell somebody to grab me the bleeding kit out of there, hopefully they can figure it out. And these are just actually pencil cases. I got them at the grocery store or something. I think they're like $2 a piece or something, but they work really well. They're clear. You can see what's in it, and kind of keeps everything somewhat organized in there. Next, I've got my miscellaneous. This has some just basic medications. Like I've got some triple antibiotic ointment in here. I've got a couple cold packs. Like I've got some aspirin, some Benadryl, things like that. This is gonna be getting replaced, and you'll see that in a couple minutes here though. Next is my vital sign kit. Open this up. And this is just things that, so I've got a pulse oximeter. So this tells you heart rate and the SpO2, the amount of oxygen in the blood. So that's something easy you can just put on and monitor what's going on with your patient. Another thing, I've got a stethoscope. When I'm working, I've got a much nicer one, but this is just, I think this is like 15 bucks on Amazon, but it's nice because it folds up in here. I've got a blood pressure cuff, and I've got a glucometer, so checking somebody's blood sugar. So if somebody passes out, that's something you can do pretty easily and see if it's from that or a different reason. And I've also got a pen light in here. So this is just a flashlight, and you can shine it in somebody's eyes to look and see for things like brain injuries or even like overdoses from drugs and things like that. Starting to run out of room here. I've also got some of these. These are just forceps. So you can reach in, like if somebody's got something in their mouth, like if they're choking, you can use this to pull it out. You don't want to just blindly shove this down somebody's throat because you could actually push whatever's in there down further. But if you can see something in, like in the back of their throat, you can use this to go in and grab it out. I've also got this. This is an HDX case just from Home Depot, and I've got like all these little popsicle sticks. I've got a bunch of different size Band-Aids, some tape, some alcohol pads here, and this is just kind of if somebody's got a cut or, you know, say like you break your finger or something, you can kind of fashion a splint out of one of these pretty simply. Set that over here. Next up down here, I've got a bunch of more bandage type things. These are triangle bandages, and so these are for things, you know, you break your collarbone, you can make some sort of like a sling and swath or different splinting things in here. I've also got an ACE bandage. Those are the stretchy ones, and so that's in the bottom. This bag has more. I've got an actual finger splint in here, some more tape, a bunch more 4x4s. This is just kind of miscellaneous to supplement everything else that I've got. I've got a bag of petroleum, well, I've got a container of petroleum jelly in a bag, and now the outside of the bag has petroleum jelly on it too. So I don't know how this stuff gets everywhere, but it does. So that's why it's in the bag. I've got a large sterile trauma dressing. This is a 12 by 30 inch dressing. And so this would be for obviously very large things, you know, abdominal wound or something like that you need, but sterile and fits nicely in the bottom there. And the last pouch here, this is my Airway pouch. So let's go ahead and get some stuff out. So I've got these are called OPAs, oropharyngeal airways, and these basically go in somebody's mouth and holds their tongue out of the way. The number one obstruction of the airway is a tongue of someone that's unconscious. Basically, the muscles relax, your tongue falls back and blocks your airway. So you can put this in and it holds it out. Again, if you aren't trained on doing this, don't just start shoving things in unconscious people's mouths. That usually doesn't go well. But if you've got the training, this would be something you could easily carry. And the last thing in here is I have, these are chest seals. Basically, if you've got somebody with a penetrating, like a gunshot wound or something else to the chest, it'll start sucking air in and they'll get a collapsed lung from that. So you can put one of these over top of it and it'll help to seal the chest off and hopefully restore normal physiology. And then in the bottom here, I've got a C-collar. So this is for somebody with a neck injury. That, I don't think I'm gonna use that very often. Okay, that was really weird. I'm just standing here and all of a sudden the power went off. So, back to where we were. I've got these in the bottom. These are cardboard splints. I actually got this idea. We used a very similar thing when I was a ski patroller, partially because they're lightweight. You just shove them in a bag, but then you can easily kind of roll it up like that, put it on the arm, and then that's where something like the ACE bandage or one of these would come into play. You just gotta be careful that it's not too tight where it cuts off blood flow, because it is gonna swell as you do that. But we've got some splinting, we've got some bleeding control, we've got some stuff that I hope I never have to use, like this and the BVM. That's for somebody who's not breathing. We've got some stuff, Benadryl, allergic reactions, or just kind of everyday stuff. But that brings me to my newest thing that I'm gonna start carrying. This stays in my truck every single day, everywhere I go. I've got another bag that if we're going way off grid that I can take that's got some more stuff long term that I don't need to carry every day, but if I'm going way out, I'll carry that bag. But the newest addition is gonna be this new medication kit. This is from Duration Health. The way this works, pretty simple. You you purchase whichever kit you want. They've got a bunch of different ones for all kinds of different things. This is called their Overland kit. They have certain ones for different regions of the world. So I think there was like in Asia and Africa. It's got medications for diseases that are more common there than in the US. And this is the one that I got. They've got a family kit. So if it's something you're interested in, go check it out. Basically, you order it, you answer all the questions. There's some criteria you have to meet, such as being, I think it was 2 hours away from a hospital for a certain amount of time, being in an area that's prone to disasters, because that's another thing where you could use this if a natural disaster comes through and knocks out the hospital system. And then you get these medications. These are prescriptions from a physician. You do mine was about 15 minutes long, but a video chat with a physician. They talk through everything. They tell you how to use all these medications, but then you also get a field guide, which, if you follow the link in my description, you can download a field guide for free from them for all kinds of different medical ailments, medical treatments, all kinds of things like that. It's very in-depth. I'm going to print it off so I have it with me on trips that I go on even. And so the cool thing about this Duration Health Kit is you get these prescriptions. And some of the things you get something called ondansetron or Zofran, which is for vomiting, but you also get some antibiotics. You get some things that you can find over the counter, so Benadryl like I had there. But you get all this that's made and put together by emergency physicians who know exactly what to put in here, and it takes all of the guesswork out of what you should have. So you got ibuprofen, you've got some anti-diarrheas, you've got some creams, so if you get into poison ivy or different things like that, or even just minor cuts. But you've got all of this in one case, put together by professionals, and so you don't have to worry about any of that. You're able to get access to this stuff long before you need it. And I mean, hopefully you never need it, but it gives me a lot more peace of mind to know that I've got all of my medications ahead of time before going out, instead of trying to figure out how I'm gonna get a medication for a certain condition when I'm way out in the woods, way off the grid, and quite frankly may not be able to safely get back in a timely manner. You're not supposed to just grab things out of here on a nice sunny day because you don't want to go to the hospital, right? We've got the providers that have gone to a lot of schooling for that know exactly what they're looking for, and trust me, it is a lot more complicated usually than just what color is the sputum coming up with your cough. So, but something like this, when you don't have access to a hospital, could potentially save your life. And one of the things I like about this is it's not so jam-packed full of stuff. You can see there's still room up top, and in the bottom there's still a bunch of room. So I think what I might do is some of the things that I had in this bag that aren't in here, a lot of like the over-the-counter things, some of the stuff, like there is ibuprofen in here, but there's some other things that are over-the-counter that I might want to put in here. Or if you have specific prescriptions from like your family doctor or something like that that you take on a daily basis, you've got room to add those in here when you go somewhere. And then all of your medications are in one kit like this, and it's just easy to take with you and have, especially when you're way out, because it's not hard to be 2 hours away from a hospital. I mean, you figure you're maybe from the trailhead to the hospital might be 45 minutes to an hour. I know a lot of places in the Upper Peninsula are like that. But then you're an hour, 2 hours, 3 hours down the trail. If something bad happens, having this and a medical kit, but really the knowledge of how to use this stuff, could very well save your life or somebody else's. Now, this is just for you. These are all individual prescriptions. They've got my name on them. They come with all the information, just like getting a prescription, like if you went to your normal doctor or a walk-in clinic or something like that. And one of the cool things is right now I don't have any plans to go to, say, a malaria area like in Africa, but if plans change and I go there in the fall for some reason, because that's peak malaria time, I could get medications here that I could take for malaria, or anywhere else in the world that I'm going that's something specific. So you can always add to it in the future. I really hope I don't ever use this, but I'm gonna start taking this on every trip that I go on. So hopefully you made it this far. This is all of the gear that I take, not just on a daily basis, but on trips. And as I've said multiple times, make sure you get the training on how to use this stuff. There are wilderness first responder classes, there are EMT classes, everybody should have CPR and basic first aid. Even if you're not into this kind of stuff, just every person should have CPR and basic first aid, regardless of what you're doing. Oh yeah, there's one other thing, some trauma shears. So this is for cutting off like clothes and things, because clothes can hold a lot of blood and cover a lot of injuries up. So a good set of trauma shears are super important, which you would learn that if you took a wilderness first aid class, trauma class, through the American College of Surgeons, I believe. It's called Stop the Bleed. And everybody thinks about this as like what to do if there's a school shooter or something, which yes, it would work there. But the #1 cause of preventable death is trauma. So think of things, car accidents, rolling an overland vehicle, motorcycle accidents, even just working in your garage. Chainsaws are a hugely dangerous thing. Everything like that. Everywhere you go, there's tons of dangers, and knowing how to handle that is going to be super helpful. So you're going to learn how to use things like a tourniquet. You're going to learn how to use different gauze and all this kind of, not everything on here, but you're going to learn a lot of this stuff up here. And That's what's really gonna save your life. Now, if you wanna see us out on a trail, on a trip, check this out. This is the most recent trip that my daughter and I went on. Spoiler alert, I didn't have to use any of this stuff, thankfully, but it was an awesome trip.